We still don't know what causes it. The one thing we do know is that the putting babies to sleep on their back reduces the risk for SID, and then there's a handful of other things that can specifically and significantly reduce their risk, tobacco being one of them, tobacco exposure. So for children with tobacco exposure, can increase the risk for diabetes, which this is a big problem for the Native American tribe as well, which is where I'm currently involved with. They can cause decreased sperm count in males. They can have cognitive development issues, language, reading, vocabulary, behavioral problems like increased activity and attention, impulsivity, and opposition and aggression, and increased delinquency and criminality. Some of this that goes along with some of the other things that we'll be talking about, where we talk about increased delinquency and criminality, it might be that these are outcomes that are perhaps mediated by earlier behavior problems or by other exposures. By the time these kids start being delinquent and criminal, we have to keep in mind that maybe they were drug exposed, but obviously, you have these children that since they were born, they've had a lot of other exposures, a lot of other things that they have had and or not had, for that matter, that may be affecting what's going on in their current state. So this is a little soapbox I have with regards to postnatal exposure. First-hand, second-hand, and if you've never heard of it, third-hand smoke, which is the one that stays in your clothes, stays on your skin, in your hair, in the furniture, in the car, and that is still has negative effects on children. So kids exposed to cigarette smoke are at increased risk for asthma, upper respiratory infections, ear infections, doctor visits, hospital admissions, et cetera, et cetera, et cetera. So I always do try to counsel about tobacco cessation. And the way I usually present that is, while you're trying to quit, in the meantime, you make